Everyone, my name is Dr. M. Niharika. I am working as a consultant in infertility in Kamineni Fertility Center in Koti. So today I will be talking about the myths that usually patients have regarding the pregnancies that have been conceived through an IVF procedure. So basically, myth is nothing but something the patient believes or understands, or when they have learned it from the other patients, or when they have seen in the internet, or when they have heard it from other people. They certain have some doubts and believe that it is true, and sometimes get scared of that, and due to that, they don't even approach the doctor for the treatment. So today I will be talking about myths in the IVF pregnancies. So the most common question usually patient asks is whether the IVF procedure is having any effect on the birth of the child, or more commonly they ask about any birth defects that the IVF procedure as such can cause in a pregnancy that has been achieved through IVF procedure. So this is completely a myth. This is not correct, because the fact is that IVF is a procedure where we usually help prepare the embryos. So the procedure as such is not going to change or modify the embryo, and hence, if at all the baby or the pregnancy ends up having an abnormal child, it is morely because of the genetic composition of the embryo, and hence the genetic parameters that have been transferred to the embryo or the child from the mother and the father. So the procedure as such is never going to induce any birth defect in the child. So that is the most commonly asked question. Next, there is another myth regarding the pregnancies that after the embryo transfer or after the pregnancy, they have to have a complete bed rest and not they are doing any activities, and that is only going to help it having a healthy pregnancy. And that is a clear no. The fact is that obviously the patient has to take the precautions that regularly they follow in the normal pregnancy. Once the pregnancy is achieved, here the treatment is only different in terms, because we have induced an artificial environment in the body and created a pregnancy. So it requires the support of this artificial medication till the body has taken over the natural hormone production, which usually takes about 8 to 10 weeks after the pregnancy, and hence the medication are little on a higher side from the time of conception to the say 2 to 2.5 months of pregnancy. But later, after the third month, the medication is similar to what we use in a natural pregnancy or a spontaneous conception. So that is the second myth usually the pregnant lady is worried about. And the other myths that usually they ask about is because in IVF we do more than one embryo transfer commonly to achieve the better implantation rates. There's always a chance that it can end up being a twin pregnancy, and patients are usually worried about the multiple pregnancies or multiple babies that are being born, because we know that if a pregnancy is having more than two babies, that is in triplets or quadruplets, the chances of the preterm delivery or the early birth is increased, and hence patients can end up having a child in the NICU for a longer period of time. But in modern with the modern technology and modern days, we usually don't prefer to transfer more than two embryos in one time transfer, and hence decrease the chances of multiple births to only being twins and not more than twins, and hence have a healthy pregnancy. So that's the most common myth usually the pregnant lady asks about. And also, because the patients are usually worried that they are taking more of hormonal injections and hormonal medication during the pregnancy or in the first trimester of pregnancy. So the mother is worried whether that is going to affect the baby or not. The medication that we use are only a hormonal support that is necessary for the maintenance of the pregnancy, and hence they are not going to harm the baby in any way. So that is the other myth that we usually worry about. And also, as I said, that patient should have a complete bed rest for about 9 months. This is another myth that the patients usually ask about, that they are not supposed to do any work from the day they have conceived till the day they are having a delivery. But that is not so. They can do their regular activities with little precaution of not lifting heavy weights, or not bending too much, not doing very strenuous activities that can harm the pregnancy. So, as I've already told, IVF is only a mode or procedure that will help in conception. After the conception, the pregnancy and the body has to react normally how they react in a normal pregnancy. Also, many people are worried that always the IVF pregnancies end up in a cesarean section. It is not so that every patient who has conceived with an IVF treatment have to end up having an cesarean section. But the incidence of cesarean section is usually high in patients who have undergone an IVF treatment, because one is that it becomes a very precious pregnancy to the mother or to the couple, that they have conceived after a lot of issues, and after a long time. And also the age of the mother matters. So if the mother is elderly, or if her cervix at the time of the assessment for the mode of delivery is not sufficient, or is not good enough for a normal delivery or trial of labor, then the cesarean delivery becomes a mode of treatment. And also, because if there are chances of increased incidence of multiple pregnancy in an IVF pregnancy, twin pregnancy, we usually do a cesarean section to have a safe baby and a safe mother. And hence the incidence is little on a higher side compared to the spontaneous pregnancies or natural pregnancies to have a cesarean delivery as the mode of delivery. But it is not always that every IVF conceived mother should go through the process of cesarean section. There are also patients who undergo normal delivery.